Leslie at the Brain Performance Center, and I want to talk about addiction, a brain disease. People do things, they drink, they do drugs, they gamble, they play video games, all to feel better and to calm the brain down, to release the stress and the anxiety. Addiction is a dysfunction of the limbic system, the brain system that involves reward, motivation, and memory. It's about the way your body craves a substance or behavior that the brain finds rewarding with total lack of concern over consequences. The neurons release dopamine, a neurotransmitter that gives feelings of pleasure. You do something you like, and the neurons kick out the dopamine. It goes from liking to wanting to needing. And the neurons keep kicking out all that dopamine, and they get confused. In a healthy brain, dopamine helps us to feel motivated, to learn, to try new experiences. Drugs and alcohol can change the functioning of the limbic system because drugs impact the dopamine. And over time, the release of the dopamine is addictive. Once the brain's dopamine supply is gone, it's difficult to feel pleasure without the drugs. Addiction occurs when the activity, whether it's drinking, gaming, whatever, becomes an all-consuming activity and causes problems in other areas of your life. Withdrawal is a common sign in addictions, and if you become frustrated when you cannot use whatever it is you're using, and the usage keeps increasing, and it's all that you think about, the only thing that motivates you, you are seeing some warning signs of addiction. Whether it's drugs, alcohol, screen time, social media, video games, if you need more and more exposure to get the same effect, that sense of well-being, your brain is becoming dysregulated. We're all searching for calm, trying to be our best possible self, and sometimes we get lost along the journey. Most signs of addiction relate to a person's diminished ability to maintain self-control. This includes changes in their social environment. Maybe they're seeking out situations that encourage a substance or a behavior, or a change in behavior, increased secrecy, or health issues, insomnia or memory loss, or changes in their personality. They may blame other people for their problems and have increased anxiety, depression, insomnia, sadness. The frontal lobes in the brain allows a person to delay feelings of reward or gratification. But when the frontal lobes malfunction, the gratification must be immediate. The frontal lobes are the last part of the brain to develop. It's the mid to late 20s, so that can impact decision making. There are other parts of the brain that may play a role in addiction as well. Genetics also increase the likelihood of an addiction. They say by about 50%, according to the American Society of Addiction. The traumatic experiences that we have during our life, that can affect our coping skills and can also lead to addictive behaviors. Addiction will play out in stages, may start with experimentation and lead to dependency. Addiction that is left untreated can lead to long-term consequences. Physical damage to the brain can create psychological and emotional issues, can destroy relationships, and leave you with economical struggles. All types of addiction are treatable. At the Brain Performance Center, we use the 3 N's: neurofeedback, neuromodulation, neuroplasticity to rewire the brain, calm the limbic system down, and train the brain to operate in a regulated state. We use cognitive behavioral therapy and performance coaching to help people understand how their thought process works and how their behaviors can be controlled or modified by identifying the self-defeating thoughts that are driving the behavior. If you feel that you or a family member may be struggling with the ability to walk away from a substance or a behavior, it's a good time to stop, learn, and listen. At the Brain Performance Center, we can help you to identify what those thoughts are and to retrain the brain to be in a regulated state. Please call for a complimentary consultation. Thank you.